Hello and welcome. I'm Dr. Gordon Saxe. Many of my patients come to me asking how to boost their immune system. Indeed, the immune system plays a central role in keeping us healthy and protected from diseases. However, what we really need to do is to balance our immune function, not just boost it, because it's when the immune system is out of balance that problems arise. In some people, the issue may be that the immune system is asleep at the switch, as in cases of immune deficiency. In others, the problem may be a hyperactive immune system, as in autoimmune disease. And in some cases, like cancer, it may be some of both. One very important component of the immune system is the process of inflammation. Ordinarily, inflammation is a beneficial mechanism that helps both to destroy pathogens, harmful bacteria or viruses, and also to repair injured tissue. But if out of control, inflammation can give rise to a variety of diseases marked by damage to normal tissues. That's why anti-inflammatory medications are so popular and why some nutritionally oriented integrative medicine doctors prescribe an anti-inflammatory diet to their patients. So today's lecture is going to focus on how to balance immunity and cool inflammation. I think that a healthy immune system should be kind of like the host at a good dinner party. It's vital, alert, and assertive, but also cool, calm, and collected. It recognizes unwelcome guests, whether a pathogen or a cancer cell, and escorts them out the door gently but firmly without upsetting or inflaming the welcome guests. To better understand the layers of our immune defenses, we can begin by looking from the outside in. We can see that our skin provides a critical first line of defense. When it's healthy, the skin keeps most, but not all, pathogens out. A few manage to slip in through the mouth, nose, or other holes in the body, as well as through any breaks in the skin. A second layer of immune defense is fever. Now, fever works by raising the body temperature to slow the growth and replication of pathogens until it figures out a way to specifically recognize and destroy them, usually by creating antibodies that target them. Another important layer of our immune defenses is our microbiota, the collection of bacteria and other microbes that make up the flora that coats the GI tract, particularly the large intestines. Because the GI tract is constantly coming into contact with outside pathogens in our food, it needs to have extra layers of defense. Healthy microbes, such as the commensal bacteria, occupy specific niches and form an orderly community that provides passive ecological defenses, a physical barrier, as well as elaboration of chemicals toxic to pathogenic microorganisms. After birth, good microbes come primarily from the fermented foods in our diet. Certain things may change the balance of the intestinal flora in a way that harms our immunity. Taking antibiotics can inadvertently wipe out some of the good bacteria and set up an overgrowth of pathogenic ones. So we need to reserve antibiotic use for when it's really needed. Eating meat can also alter microbiota. Studies have shown that people who eat westernized diets, high in meat, have microbiota profiles found to be pro-inflammatory and to be associated with a variety of autoimmune disease states. Now, I've talked indirectly about things that are pro-inflammatory with somewhat of a negative connotation. However, inflammation in and of itself is not a bad thing. Inflammation is one of the body's first responses to infection or tissue injury. Damaged tissue sends out chemical signals that attract goodies, such as white blood cells and cytokines, to the site of injury to help clear the pathogens and promote wound healing. But inflammation is only good when it's controlled. When the stimulus triggering the inflammatory process is ongoing or chronic, problems ensue. And quite often, the inflammatory stimulus comes from a poor diet. For example, a common way that diet can stimulate inflammation is through the generation of free radicals. Free radicals are unstable molecules that can cause oxidative damage to the body's cells and inflammation of tissues and organs. A common source of free radicals in the diet is polyunsaturated fat, such as corn and vegetable oil. When oils come in contact with heat, air, and light, they begin to oxidize, turn rancid, and generate free radicals. Perhaps the worst offender is oil used in a deep fryer. Oils are not a whole food, so generally I discourage their use. However, some oils, such as olive, sesame, and walnut, can, in moderation, be healthy additions to the diet and aid absorption of fat-soluble nutrients like vitamin E, a potent compound that can neutralize free radicals and prevent oxidative damage. By definition, an antioxidant. Free radicals are also generated when we fry, grill, or barbecue meat, causing the formation of substances called polycyclic aromatic hydrocarbons, or PAHs. PAHs are a double whammy, as they can also be converted into potent carcinogens. The best way to offset damage from free radicals is to eat a diet that's naturally calorically restricted and high in antioxidants. Research suggests that reducing calories by about a third may be the singularly most effective way to slow the aging process, maintain the health of the immune system, extend survival, and prevent the development of cancer. Interestingly enough, when people switch from the standard American diet to a whole food plant-based diet, their caloric intake typically drops by about a third, without having to count calories, go hungry, or deny themselves. Another way to offset free radicals is to eat foods rich in antioxidants. For example, dark berries and cherries contain abundant antioxidants called anthocyanins, while orange red and dark leafy green vegetables and fruits contain others called carotenoids, like beta-carotene, lutein, and lycopene, as well as the antioxidant vitamins C and E. Also important are the minerals selenium, which concentrates in onions and sea vegetables, and zinc, best sourced from sesame and pumpkin seeds. Another way dietary factors trigger inflammation has to do with molecules called prostaglandins. Most nonsteroidal anti-inflammatory medications, or NSAIDs, such as ibuprofen and aspirin, operate by blocking the biochemical steps in the conversion of a compound called arachidonic acid into other ones called prostaglandins. And the most abundant source of arachidonic acid comes from animal products in the diet. When we restrict animal products, arachidonic acid levels drop by about 90%. It's an even more effective way to reduce the production of prostaglandins than taking NSAIDs. Uncontrolled inflammation can also be caused by an imbalanced microbiota and by a closely related condition referred to as a leaky gut. When we consume a highly refined diet devoid of fiber, and note that fiber is only found in plants, or one that's high in toxic gluten, such as that which is found in some of the most widely consumed and sometimes genetically modified commercial strains of wheat, damage to the gut can occur, and this can lead to the formation of cracks and fissures in the intestinal lining that permit the entry of large molecules from partially digested food directly into the bloodstream. This is called leaky gut syndrome. And in leaky gut syndrome, the immune system mounts a response against these foreign molecules that end up damaging innocent bystander tissues of the body, resulting in inflammation and autoimmune disease. Let's switch gears now and discuss the role of the immune system in cancer. How an underactive immune system can give rise to cancer was first observed in transplant patients who used immunosuppressive medications to prevent their bodies from rejecting a transplanted organ. And it turned out that their risk of developing cancer was greatly increased. Also, in the early days of organ transplantation, doctors recommended high levels of polyunsaturated fat, such as in some margarine, to prevent organ rejection. until they discovered that patients consuming these fats were up to 20 times more likely to develop secondary cancers. Other immunosuppressive agents, such as radiation, have long been known to lead to the development of cancer. Radiation is an interesting topic. One of my med school professors was the director of the Radiation Effects Research Foundation in Hiroshima, Japan, the site of the first atomic bomb dropped in World War II. By studying atomic bomb survivors, researchers discovered that high levels of radiation exposure had two effects. In the short term, a sharply increased risk of acute leukemia, and in the long term, an increased risk of lung, thyroid, breast, and other cancers. And it may be that the Japanese have the most to teach us about how to use foods to protect against radiation. In Nagasaki, the site of the second atomic bombing, St. Francis Hospital, located about a mile from the epicenter, survived the initial blast. On one ward of the hospital, there was a physician named Dr. Akazuki who fed his patients a traditional whole food, plant-based Japanese diet that included barley porridge, Hokkaido pumpkin, and miso soup with seaweed. On the other wards, the patients were fed a more westernized diet. 55 years later, researchers followed up the health outcomes of patients from St. Francis Hospital and found that at that time, still about a third of the patients on Dr. Akazuki's ward were still alive, and none of these surviving patients had developed leukemia or other cancers. Almost all other patients from the hospital had died. More recent studies have shown that some of the foods Dr. Akazuki fed to his patients contain both potent radioprotective and cancer protective effects. For example, the seaweed in the miso soup contains a compound called sodium alginate, which binds heavy metals like cesium and strontium, as well as their respective radioactive isotopes, and actually clears them from the body through the GI tract. In addition, seaweed is a rich source of iodine, which saturates the thyroid gland and prevents it from taking up radioactive iodine, specifically protecting against thyroid cancer. We also know that pumpkin is rich in antioxidants, and miso is teeming with active cultures like lactobacillus and bifidus. Now let's talk about another important line of defense against cancer: immune surveillance, a function provided by natural killer or NK cells. NK cells identify tumor cells circulating in the bloodstream and orchestrate an immune response against them before they can take root and form a tumor. Fortunately, a variety of foods and herbs have been found to increase the level of natural killer or NK cells. Several of these are mushrooms. Shiitake and maitake mushrooms have both been shown to increase the number and function of NK cells, as well as the levels of anti-cancer macrophages and cytokines. So do mushrooms called cordyceps and reishi, often found in Chinese herbal formulas. And so does ginseng, a root that's prized in Asia and has been used for centuries to promote vitality. In Chinese medicine, it's believed that these herbal foods would boost what they called the wei qi, a protective energy of the body akin to the immune system. And again, perhaps the most effective way to prevent or stop the growth of cancer and to simultaneously support the health of the immune system is through caloric restriction. Regardless of how cancer is triggered in the first place, whether by chemical carcinogens, radiation, or viruses, research suggests that caloric restriction may either dramatically slow or stop cancer in its tracks. Conversely, obesity has been found to greatly worsen the health outcomes of those with cancer. Scientists believe that one reason is because fat tissue is extremely metabolically active and the site where inflammatory mediators, such as interleukin-6 and tumor necrosis factor alpha, are produced, and that drive inflammation, kind of like pouring gasoline on the fire of a growing cancer. Another way that inflammation may accelerate cancer is by promoting angiogenesis, which is the formation of new blood vessels. Part of the inflammatory process to support tissue repair. Almost 30 years ago, researchers discovered that in order for a cancer to grow, it requires a steadily increasing blood supply delivered via blood vessels. So, by cooling inflammation, it may be possible to also turn off the angiogenesis that feeds cancer growth. Interestingly, most of the foods that have been found to have anti-angiogenic properties are the same ones thought to be anti-inflammatory. So, the best way to naturally balance the immune system and cool inflammation is, you guessed it, a balanced diet and lifestyle. First and foremost, I recommend follow a whole food plant-based diet incorporating the 5 pillars approach. These are 1. Eat plants. 2. In their whole form. 3. Balanced with variety, color, texture, taste, cooking method, and personal need. 4. Focusing on those that are locally grown and in season. And 5. That whenever possible are organically or biodynamically grown. If you do this, you will automatically be avoiding excess calories, which, again, perhaps more than any other single factor, inhibits cancer, cools inflammation, and helps maintain the vitality of the immune system over the course of one's lifetime. Second, be sure to emphasize antioxidant-rich foods, such as whole grains, like brown rice, beans and legumes, seeds and nuts high in B vitamins and vitamin E, and gut health supporting insoluble fiber. Also, cabbage family vegetables such as cabbage, broccoli, kale, collards, and turnip greens that are rich in carotenoids, vitamin C, and other beneficial phytonutrients. Onion family vegetables such as onions, leeks, and garlic that are rich in antioxidants such as the mineral selenium and the compound allicin. Fruits such as dark berries and cherries, rich in anthocyanins and insoluble fiber. And sea vegetables, rich in trace minerals taken up from ocean water, as well as radioprotective factors. Third, reduce exposure to pro-inflammatory arachidonic acid by limiting or cutting meat out of your diet, and especially avoiding fried or grilled meats high in free radicals. Also, to reduce free radicals, use only high-quality cold-pressed oils, use them sparingly, and keep them refrigerated. Fourth, maintain a healthy gut by regularly consuming fermented foods like miso, tempeh, naturally prepared pickles, and sauerkraut. Fifth, and finally, try to incorporate immune-potentiating foods such as shiitake and maitake mushrooms, turmeric root, green and kukicha tea, and others into your diet. By using the natural healing power of foods to balance your immune system, you're giving yourself the gift of a lifetime. Use your imagination with these dietary recommendations and you'll bring color and vitality to your body and your life.